Hi, my name is Dr. Brandon Lee. I'm an ophthalmologist at the Cataract and Vision Center of Hawaii, and today I'll be speaking about cataracts and the aging eye. Good vision is something that many of us take for granted when we're young, but as we get older into our senior years, many seniors become very dependent on good vision to maintain an independent and active lifestyle. There's a common misconception that as we age, our vision will gradually deteriorate, and that doesn't have to be true. Cataracts are the most common eye condition affecting older adults. Cataract refers to a clouding of the eye's natural lens that occurs with age. It is not a disease, it's a part of the natural aging process, meaning that at some point in life, all of us will develop a cataract. Early on, cataracts may not cause any symptoms at all, and patients may go for many years with a cataract having relatively good vision. However, at some point, the cataract gradually advances and the patient's vision will become cloudy and blurred, almost like looking through foggy glass. As cataracts advance, many patients have difficulty driving at night due to glare from the oncoming headlights. They can also experience difficulty seeing in certain lighting conditions, or colors may appear faded or washed out. At a certain point, your vision will no longer be correctable with glasses or contact lenses, and at this point, it's time to consider cataract surgery. Cataract surgery is a quick outpatient surgery that generally takes about 15 to 20 minutes. After the surgery, most patients are able to return to most of their regular activities within 1 to 2 days. Cataract surgery involves removing the cloudy lens from the eye and replacing it with a clear intraocular artificial lens that will take its place after the surgery. Once the new lens is in place, it's meant to stay there for a lifetime, meaning that cataract surgery is generally a one-time procedure. One of the benefits of cataract surgery is that for those of you who wear glasses or contact lenses, the corrective power of your glasses or contact lens can be built into the lens that's implanted in the eye, meaning that many patients who have been reliant on glasses their entire life may be minimally dependent on glasses or may not need them at all after surgery. Some people have what we call astigmatism, meaning that instead of being round like a basketball, their eye is shaped oblong like a football. And typically this requires glasses to correct. You now have the option of correcting your astigmatism at the time of surgery. One of the most recent advances in cataract surgery is the advent of what we call laser cataract surgery. Traditionally, cataract surgery has been performed manually by hand using handheld instruments. Within the last couple of years, we now offer what we call laser cataract surgery, where many of the steps that were traditionally performed by hand are now performed with the use of a laser. The laser can make a perfect cut, which is more precise than any surgeon's hand can make. And the laser can actually soften the cataract prior to surgery so that when we remove it, the surgery is much more gentle and allows for more rapid healing time. Another major advantage of laser cataract surgery is you can correct astigmatism at the time of surgery so that patients are less dependent on glasses for clear vision after surgery. Another advancement in cataract surgery is the use of premium intraocular lenses. Traditionally, the lens that we implant in the eye can only correct for either distance or near vision, meaning that you would have to use glasses for the other one. Most patients opt to see clearly at distance so that they only use glasses for reading up close. However, patients with astigmatism may require glasses for both reading and distance vision. Another recent advancement in cataract surgery is the advent of toric and multifocal intraocular lenses. A toric lens is a lens that we implant in the eye that's capable of fixing astigmatism at the time of the surgery. This means patients with astigmatism, whose vision would typically be out of focus after surgery, can have clear vision and would be minimally reliant on glasses after the surgery. They would still need glasses to see up close, but their distance vision, meaning their everyday vision, would be sharper and more in focus. The toric lens is an alternative to using a laser to correct astigmatism at the time of surgery. We are also able to offer what we call a multifocal lens at the time of surgery. A multifocal lens is a lens that we implant in the eye that's capable of focusing up close and far away without having to use glasses. Because cataracts are a normal part of the aging process, there's very little that we can do to prevent cataracts. However, back in the day, many patients were afraid of having cataract surgery. Nowadays, many patients actually look forward to cataract surgery because of these options in reducing their dependence on glasses. Although cataract surgery is generally a one-time procedure, some patients can develop what we call a secondary cataract, which means that the capsule that typically holds the lens can opacify after the surgery. This can occur either months later or even years after the surgery. However, a secondary cataract is a very easily treatable problem and is typically corrected with a quick laser procedure in the clinic that's covered by insurance. It's important to note that both the use of the laser or a toric lens to correct astigmatism are not completely covered by insurance, meaning the patients typically have to pay an out-of-pocket fee. However, patients really enjoy the benefit of being able to see clearly for the first time in their lives without glasses. I hope this gave you a good overview of cataracts and some of the recent developments with modern cataract surgery. Again, my name is Dr. Brandon Lee from the Cataract and Vision Center of Hawaii. For more information on cataracts or cataract surgery, please visit our website at cataractandvisioncenter.com. Mahalo.